Diabetic neuropathy. Nowadays, many of the people having diabetes. So it may type 1 or type 2. So type 1 diabetes having diabetic neuropathy for at least 66%. Type 2 diabetes mellitus people having 59% people having diabetic neuropathy. What is neuropathy? Opathy means disease. So neuro means nerve disease. So due to diabetes, there is a nerve disease caused. So myself Sukumar, I am the student of occupational therapy. What is happening in diabetes? Our blood glucose level is increased, which means in blood there is more glucose are present. So it is also known as hyperglycemia. So hyperglycemia is the risk for the getting diabetic neuropathy. And duration of the diabetes, duration of the increased blood sugar is more, then they have chance to get neuropathy. The person having hypertension with diabetes having the risk for getting the neuropathy, and the person may be alcoholic or smoking also having the risk, and the person may be aged, it also be the risk for the getting diabetic neuropathy. What are all happening in the diabetes? So there may be a formation of ischemia. So nerve ischemia means nerve does not getting enough blood supply, which means in blood there are the many glucose are present, so the nerve can't able to capture the glucose and it causes the ischemia. I want to clearly say, so there is two terms, right? Hypoxia, ischemia. Hypoxia means reduced oxygen supply, ischemia means reduced blood supply. So the nerve is intact and the blood glucose level is increased. In blood, there is a decrease in essential fatty acid for the nerve. So it causes the nerve disease. Or else the nerve can't able to grab the glucose. So type 2 diabetes, so it can't able to grab the glucose and get its sufficient energy. It also damages the nerve and causes neuropathy. Our nerve cells have glucose tolerance, so every cells in our body has a glucose tolerance, so this much of glucose can be taken to this cell. If the blood glucose level is increased, there may be a chance to giving more glucose to the cell. It break the glucose tolerance and it causes the diseases. Or else normal glucose tolerance, if cells have some glucose tolerance, so if it reduced for the cell, so glucose level is normal in blood, but the cell has reduced glucose tolerance, it also causes the disease for this cell. Before going to see the causes, before going to see the clinical features of diabetic neuropathy, we have to refer the clinical features of non-diabetic neuropathy. In non-diabetic neuropathy, motor damage is more than sensory damage. So they have paralysis that like. So in non-diabetic neuropathy, they have more motor involvement than sensory involvement. And the nerve fibers, large nerve fibers are involved more in non-diabetic neuropathy than small nerve fibers. But in diabetic neuropathy, small fibers first get involved in distal region. They have difficulties, then they have difficulties in proximal region, but in non-diabetic they have larger nerve fiber involvement first. And by considering the symmetry, in non-diabetic they have the asymmetrical nerve damages, so they have only right leg, only left leg, only right finger, that like. But in diabetic neuropathy, symmetrical, if they have nerve compressions or something, so they have in both sides. By these clinical features, we can differentiate the diabetic and non-diabetic clinical symptoms. What are other signs means the therapist should check for it. So ankle reflex. For diabetic neuropathy, ankle reflex may absent. I already said there is a distal impairment. So they don't have proximal impairment. Shoulder is very well, but they have distal impairment in diabetic neuropathies. Some symptoms of diabetic neuropathy, when we walk in a cotton or any textured area, we have noticed a numbness, tingling sensation, pin pricking sensation, needle pricking sensation may be felt by the persons. Some persons may feel hot or cold in the distal region. They have hot in this region, but there is no hot substance is placed, but they can sense the sensation. They have the chances for getting muscle cramps. These distal symmetrical sensory motor polyneuropathy, there is a problem in first distal part, then in proximal part. They may have complications like retinopathy, nephropathy, like this. The word opathy means disease. So we are going to count what are all the diabetic neuropathies. First I said distal symmetrical sensory motor polyneuropathy. Then neuropathy related to IGT, impaired glucose tolerance of the nerves. So nerves having tolerance, that tolerance is impaired, then they have neuropathies. In this they may feel more pain. For them we have to check for the GTT, glucose tolerance test. So by using the glucose tolerance test we can conclude it as neuropathy related to IGT or hyperglycemia. Hyperglycemia means the nerve cells does not record that much glucose, but the increased blood glucose level causes the hyperglycemia to the nerve cells and it becomes neuropathy. Or else IGT means impaired glucose tolerance, which means blood is giving sufficient amount of glucose to the nerve cells, but nerve cells having reduced tolerance. Okay. Third, diabetic neuropathy, acute painful neuropathy. For these persons, weight loss, severe pain can be seen and they may have chance for the depression, having depression and impotence, which means they can't do anything. So like that, they feel they can't potential. So that like symptoms are shown in the person. This acute painful neuropathy can be seen in prior to the diabetes mellitus or after institution of the treatment. For this acute painful neuropathy, distal part is involved initially and then proximal part is involved. So first starts from the distal part. They have pain in this area, then the pain is radiating to the proximal parts. They may have chance for the getting burning sensation, electric shock like sensation. These are all present. Next, autonomic neuropathy. The word itself is autonomic, which means there is a involvement of autonomic nervous system. And obviously opathy means disease. So there is a disease in the autonomic nervous system. Then fifth neuropathy for the diabetic neuropathy is cranial neuropathy. Cranial means there is a involvement of cranial nerves, mostly ocular nerves like oculomotor nerve, trochlear nerve and abducen nerve. These nerves are mostly affected and facial nerve also affected in the cranial neuropathy. We know oculomotor nerve supplies the muscles which are responsible for the eye movement. That's like trochlear nerve and abducen nerve also supplies the eye muscles SO4 and LR6. SO4 means superior oblique muscle is supplied by the trochlear nerve and a lateral rectus muscle is supplied by the abducen nerve. So these muscles are getting palsy in this neuropathy. We can say it as cranial nerve 4 palsy, cranial nerve 3 palsy, cranial nerve 6 palsy, and facial nerve, cranial nerve 8 palsy. Sixth diabetic neuropathy is truncal radiculoneuropathy. What is radiculo means the root point is affected. So the nerve origin is affected. That is called a radiculopathy. What is truncal? There is something related to the trunk region, chest and this abdomen region. So obviously there is a pain. So that is the first symptom, pain in the chest region and the abdomen region. The pain is worse at night time. There is a chance for getting the weight loss. Their anterior abdominal wall may get weakness. In this, some thoracic roots and lumbar roots are involved, which means the root nerves are getting disease in this truncal radiculoneuropathy. Seventh, lumbosacral radiculoplexus neuropathy, which means there is a root radiculopathy means root regions are affected. Lumbosacral radiculoplexus means lumbosacral plexus root region are affected in this neuropathy. It is more common in men with type 2 diabetes mellitus. So if there is a involvement of the lumbosacral region, then we can conclude they have the lower limb weakness or lower limb paralysis. It is also known as Brenn's syndrome. So lumbosacral radiculoplexus neuropathy is also known as Brenn's-Garland syndrome. In this, knee jerk is depressed or absent. We have to check for the systemic inflammation. So if we have doubt in the systemic inflammation, we can consider CT for the pelvis, MRI, CSF fluid and electromyogram. Then eighth diabetic neuropathy is compressive neuropathy. So in diabetes, compressive neuropathy are also higher. Carpal tunnel syndrome, ulnar nerve compression in the elbow region, peroneal nerve compression in the fibular region. So for these compressive neuropathies, treatment are like non-diabetics nerve compression. Overall, our treatment focus on the pathogenic mechanism. What is the pathogenesis of the neuropathy? We are focusing on the pathogenesis. So if blood glucose is the problem, then we have to focus on the normalization of the blood glucose. And abnormal oxidative reactions are there, then we have to focus on the oxidative, antioxidative therapy. If the pathogen is the aldose reductase reaction, then we have to inhibit the aldose reductase. If nerve growth factor is affected, then we have to focus on the nerve growth factor. So drugs for the inflammation is non-steroidal anti-inflammatory drugs. If the person have depression like that, then we can give antidepressives. So I am going to conclude. So distal symmetrical sensory motor polyneuropathy is the commonest diabetic neuropathy. To differentiate the IGT associated neuropathy, we have to check for the glucose tolerance test. For these diabetic neuropathies, prevention is better than cure. Okay, so we have to prevent these diseases. So what is the best way to getting out of these diseases is the normoglycemia, which means normal glucose level should be maintained in the blood and in the nerve cells. My informations are more useful for you, so I also need motivation. Please subscribe to our channel. Thanks for watching. So be proud to be watch this video. Thanks.